photo. So that's always really helpful when I can show a photo, because it helps me to explain things better. And I hope it will help me explain to this patient who has requested umbilicoplasty. So the request came in to say, do we do umbilicoplasty at the clinic? And that's quite a that's a word that can mean quite a broad range. So it's, you know, do we do umbilicoplasty? Well, yes, we do. Umbilicoplasty just means changing the shape of the umbilicus or the belly button, and we can change the shape of the umbilicus, but it's not that common to be asked as a standalone procedure. Umbilicoplasty is usually done either for people born without an umbilicus, without a belly button, if they have the sort of externalization of their abdominal contents and a defect in the abdominal wall, which is a pretty rare congenital defect. Or the more common situation for umbilicoplasty is for people who've had a tummy tuck, when you kind of recreate the belly button when you're as part of a tummy tuck. So umbilicoplasty is a sort of integral part of a tummy tuck. So that's the most common time when we do an umbilicoplasty. So it's a little bit odd when someone asks about an umbilicoplasty on its own. It's usually done as part of another procedure. So ask for a photo, and the patient sent in their photo. So this is the photo, and my so on Instagram, I'm going to add, there is a way of adding the photo. Request to join. Turn the camera off. I have. Oh, if we've got a question, tap a question to answer. Okay, I'll do that in a minute. How do you show a photo? I've definitely done this. The problem with the Instagram Live is that you can't kind of practice it. So you end up doing this sort of stuff live on TV. Now, I've definitely done it before, so I know it's there. Links you share. I don't know how to share a photo, show a photo on. Right. Okay. Well, you know, because I've done it before, I kind of thought, okay, you know what I'm going to do? I'm going to turn the camera around. Right, there it is. There's the photo. So I don't know if it's probably not as good, but I don't know if you can see kind of there's an abdomen with a belly button and some wrinkly skin above the belly button. So I think that's kind of the issue. I don't know if that's what the patient has verbalized, but I'm assuming it's this kind of wrinkly skin above the belly button that is in question, and that is what this patient is requesting an umbilicoplasty for. So the answer to that is, I don't think an umbilicoplasty is enough for that. So the answer to that, to this patient, is kind of like, if they're saying, do we do an umbilicoplasty? Yes, we do. Would I do an umbilicoplasty for that? I wouldn't, and the reason I wouldn't is because I don't think I could get enough tightening of that skin to give a satisfactory result by just operating around the umbilicus, just operating around the belly button. I think that is a sort of global laxity of the skin above the belly button, and personally, I've tried and I can't get a really good tightening of the skin by just using a scar around the belly button. So I can't do that very well. So the easiest thing to say, particularly for this patient without seeing the whole of the abdomen, it's not that easy to see the whole of the abdomen. The easiest thing to say, I think, for this patient is that we can't help you. if you're going to do anything to tighten that skin, that's a tummy tuck really, because a tummy tuck would pull that skin down and tightening that skin. But you need a certain amount of skin laxity in order to do a tummy tuck. So I'm not even sure if this patient's a candidate for a tummy tuck. And unfortunately, if you're going to get to above the belly button, that means you need a full tummy tuck. So you can't have a mini tummy tuck, because a mini tummy tuck only tightens the skin below the belly button. So it wouldn't tighten that skin above the belly button. So if you're going to do anything to tighten that skin, the best thing to do would be a full tummy tuck. But that might be a bit of a sledgehammer to crack a nut if it's just that little bit of skin laxity there. So personally, I'd be interested actually if anyone, any plastic surgeons out there think that they could make that better with a scar just around the umbilicus, because I don't think I could. And I don't think there's enough for a full tummy tuck. So it's a tricky one. Often the sort of mild things are tricky ones, because this patient's obviously got a good abdominal contour with just a little bit of spare skin above the belly button. Whether some kind of skin tightening kind of non-surgical procedure, radio frequency type thing might help, I don't know. I don't do that sort of thing, but that might be something to consider, something to give a bit of skin tightening, because that's basically what's needed, a little bit of skin tightening. Just for those of you who recently joined, this is what we're talking about, this lump, this pain, the thing, this skin there. So, well, look, that's me. I'll turn the thing around. There's me again. So yeah, so that's actually quite a difficult problem to correct. And bottom line is, I don't think we could, because I think it's just too difficult to correct using a scar locally around the belly button, and I think it's not enough laxity to warrant a full tummy tuck, probably, without seeing and examining. And I think probably a full tummy tuck's a little bit too much for someone who's just got a little bit of laxity above the belly button, unless she has got problems with it globally around the abdomen, in which case maybe she might want to consider a full tummy tuck. So we've got something here. Fatty, painful lump on lower back gets larger at menstrual time. Went private to have it removed, as said it was a lipoma, but instantly returned. It's like fatty, squishy, but is now very painful. What would you recommend? So what you're saying, Corkum, is that you've had it removed and it returned. Is that what you're saying? So you went to have it removed and now it's returned and it's painful. So the first thing is, so I'm not sure, I don't know if I got that right. So if that's the case, the first thing is, did you have it removed? Did they say it was a lipoma? Did they send it off? Could they obviously see it was a lipoma? So that's the first thing. So a lipoma is quite distinctive when you remove it. It's kind of like a fatty lump, and sometimes they'll, yes, but it didn't go after swelling. Yeah, so that's the first thing. So if you've had it removed and it's a lipoma and now you've got a painful swelling, two options really. One is that it's swelling, and probably you will have swelling, certainly if you have the first few months. Yes, lipoma, but no update after sending it off. So it's so if you're in the first few months, by 3 to 6 months, there's going to be swelling. And people often say to me, they say, oh, it's come back again and what have you. But there's often quite a lot of swelling, especially if it's quite a big lump, because it's the space where it was. So that often fills up with fluid and what have you. So you do get swelling, but it might, and some, as I say, people often say you left some behind or what have you. And I always say, like, I might have left some behind. I don't think I did, but you can't sort of guarantee you haven't. So there is a chance that there might be some left behind. And so it might need to have it removed again if there is. But I would wait at least 3, probably 6 months before thinking about that, just because you want to be sure the swelling's gone down. Because if it's just swelling and you go back in and there's nothing there, it's not great. So, you want to be pretty comfortable that there is something there. And also the fact that it's painful kind of suggests it's a post-op thing, because lipomas aren't normally painful. So the fact that it's painful suggests that it's more of a post-op swelling and discomfort from the op, rather than a recurrence of the lipoma or residual lipoma left behind. Always difficult without seeing and examining you. But if you're saying you've had a thing removed, they said it was a lipoma, and now you've got a lump and it's painful, I'm kind of thinking that's probably a post-op swelling type thing. Although, as I say, you could never guarantee it's not some lipoma left behind. Oh, 2 years this happened. Oh, okay. So 2 years ago, right? That changes things slightly. Yeah. Oh well, if you still got a lump 2 years post-op, Corkem, yeah, I would say they need to explore it and remove it again, and maybe have a scan to see what it is. Yeah, I mean, I would work with your Nuffield Warwick. I would work with Nuffield Warwick. I reckon they're pretty good, aren't they, Nuffield? I'm sure they'll. Are they not looking at, you know, maybe do a scan, see what it is? I mean, if it's a lump that you can feel, then if you can feel it and it's 2 years post-op, then, you know, there's something there. Maybe have it removed again. It's difficult, this, because I'm like, I don't know what's gone on, but I would have thought that your doctor would hopefully kind of be working with you on this one and trying to help you out and discovering what you've got and trying to help you to fix it. So yeah, so 2 years post-op, that's unlikely to be swelling. But as I say, it is unusual for it to be painful, so it is a little bit unusual. But you know, maybe it is some lipoma left behind. But so yeah, I would say either surgical exploration or possibly if it's a bit unclear and it's just squidgy and it's not an obvious discrete mass, maybe an ultrasound scan or some kind of scan to see what it is. If it's obvious and you can kind of feel something, I don't know. I probably have a low threshold to just do surgery and remove it if you can kind of feel a lump. That's kind of where I am. Didn't like the surgeon. I think I'll book a consultation with yourself. My twin had tummy tuck with you, and she's had no issues. Thank you for your feedback. Oh, that's kind. Yeah, I mean, by all means do, and I'd love to see you. Usually, though, the original surgeon kind of got a vested interest to get it right, especially if they're a plastic surgeon and stuff. Well, I shouldn't say especially. I'm sure any surgeon would, and they often do it like reduced fee and maybe even like not charge sometimes and things if it's from the original surgery. Whereas if you see someone else like myself, you know, would charge, but you know, but you're more than welcome to, you know, the other thing, Corkem, is you can, if it's visible, then you can email it, you know, send us a photo of it. If you have had any scans, you can send us the scans, and I'll certainly give you an opinion kind of remotely if you have any information like that, a photo or a scan or anything like that. You know, I'll be very happy to, yeah, very visible. So if you send us a photo, I'll be happy to have a, you know, give you an idea, because what we're doing these days, it depends on where it is and how big it is and things. We do these see and treat things, and it depends on how far. So if you're in Warwick, you're not that well. No, you know, but if people often come, and if you are having to have something done, they have it done at the same time to save you coming back and forth. We're doing the see and treat thing, so it's sort of something that I'm kind of promoting at the moment, the see and treat clinic, where we, you know, do things on the same time as the consultation, because we have a, you know, send us a photo and we can tell people what we can do before they actually come. So so yeah, that's an option. So yeah, I had another question here, which question from Stories. If removing multiple moles, does the cost depend on the size of each mole? Type of question to answer it. Yeah, basically. So yeah, short answer. The cost of mole removal depends on the size and the location. So for instance, a abdomen or something like that is kind of quite an easy area with quite a lot of laxity. So, you know, it's relatively easy to take moles off areas with laxity, whereas the nose, for instance, has not any laxity. So kind of like a smaller, or for the same size, but like this, a mole of the same size on the nose would be more difficult to remove than if it was on the abdomen. So it's size and location. So a kind of smaller mole on the nose might be more difficult than a bigger mole on the abdomen. That makes sense. So size and location. And for multiple moles, we have a sort of thing where we charge you less for the second one and stuff, because obviously we've opened this pack and all that. We're not trying to encourage you to have mole removal. It's just that we've opened the pack, and so it's one lot of kit. So yeah, it's cheaper for multiple moles, and the price is dependent on the size. Can you correct ears without having surgery? Yes, you can. You'd think so, wouldn't you? There's a thing called the ear buddy. Basically, you can correct prominent ears without having surgery. The proviso is you can only do it when the cartilage is soft and malleable, which is when you're very young, i.e. babies. Basically, we're talking babies here. You can't really do it once you get into sort of children, even like small children and things. You know, it's really sort of newborn and like first year of life type stuff, which is a bit harsh doing it to so but you know, in terms of the sort of surgical nature of it, you have to do it when the cartilage is malleable, so the earlier you start the better. So it is possible to try and remold the cartilage using kind of external splints, but it's, as I say, it's not very effective. Once the child gets, you know, a few years old, that cartilage becomes kind of harder and less malleable and not quite as soft, so it's much more difficult to contour. So yeah, it's a bit of a tricky one, that, because you don't want to sort of have a newborn baby and say, oh, look at the ears, we've got to get those ears fixed. So it's a difficult one, and it's one, you know, but it is possible. But I think most people, when they have a newborn baby, that's not kind of high on the agenda, worrying about their ears. So yeah, that's why normally it comes to surgery once the child's a few years old. Can we remove a pyogenic granuloma? Yes, we can, and we've done quite a few. Well, yeah, a handful, I suppose, recently. Pyogenic granuloma is kind of like a red, raised, quite florid skin lesion, which can look like a skin cancer, can look like an SCC. Usually it's after some kind of trauma, might be like a thorn or an insect bite or something like that, and usually kind of quite rapidly growing. So people often worry that it's a skin cancer, but the history, certainly if there's any history of trauma, but also the rapid growth, kind of suggests more pyogenic granuloma. And sometimes you can have a little skin cancer at the base of it. But yeah, they can be quite sort of florid and quite active and quite obvious, and perfectly reasonable to remove them. Not only because they can be quite large and uncomfortable and they can bleed and what have you, but also to kind of, if you are worried that there might be a skin cancer there, it's probably best to get it off and biopsied to make sure that it is actually a pyogenic granuloma and not a skin cancer. So we can certainly remove them. They don't all have to have surgery. You can do things like cautery and things. If it's a little bleeding thing, you sometimes doctors can cauterize and what have you. The stuff that we do at the clinic is mainly surgery, and we definitely can treat pyogenic granulomas for sure. Why don't we treat patients under the age of 18? Simply because of the regulation. It's simply because of the regulation. It's not because we can't. And let's be honest with ourselves, a 16, 17-year-old, well, inverted commas, child, you know, with a mole on their face, the surgery is exactly the same as if it's a 24-year-old or a 19-year-old. You know, there's no difference from the surgical point of view, but officially anyone under 18 is classed as a child, and the regulations about treating children are very strict. And it's just not worth us going through all those regulations, because it's not a huge number of patients that want treatment, maybe moles and what have you on children. But in terms of the regulate, and I'll be honest with you, I think a lot of the private hospitals are realizing that, and they're not treating children either. You need an awful lot of hoops to jump through in order to treat children. And I think a lot of people are finding that it's just not really worth going through all that legislation. But it does make it difficult for people to have their children treated, especially when you get to sort of 16, 17 years old, because they're, you know, physiologically quite large individuals. And as I say, if you're talking about a minor procedure like you know, fixing an ear or taking a mole off, or something relatively low risk type procedure like that, but still, on the, you know, we are not allowed. So we just said to the CQC, right, that's it, we're not going to treat patients under 18. And so there's a whole lot less in terms of the paperwork and the legislation that you need to have in place in the clinic. So that's purely it. I mean, when I was in the NHS, I used to treat children. I think most of us, do treat children. We've had, pediatric plastic surgeons working at the clinic. Vicky, the clinic nurse, is actually a pediatric plastic surgery nurse. That's her background. So we have got the staffing and the expertise, but it's just purely the legislation that we haven't got, and that's why we don't do it. Can we remove a fibroadenoma? No. Fibroadenoma is usually a breast lump. It's a benign breast lump, and that would usually be managed by a breast surgeon, which would be a general surgery trained doctor who would be treating the investigation and management of breast cancer. We as plastic surgeons do work on the reconstructive side of things, but on the diagnosis and excisional side, that's usually a different type of surgeon who's as I say, a breast surgeon, which is who's gone through general surgery training and then subspecialized in breast, and they do all the cancer work, and they would do, a fibroadenoma is a benign lump, but sometimes you don't know it's a benign lump when you're removing it. So that would be treated by a general surgeon rather than us. Can we remove a cyst that is infected, inflamed? Well, that's the can question. You can, but I wouldn't. We tend not to. And it's often the way that people say, oh, it's really bad, I need to get it done. It's infected, it's inflamed, it's uncomfortable, this discharge. But that's not the time to remove it, because if we remove it and we give you a cut and a scar, that cut is likely to get infected. The wound's going to get infected. So the idea is, so you need to get it treated, whether that be a GP or A&E or whatever. You can get it lanced, antibiotics, whatever needs to be done. And when the infection is quiet and settled, that's when we removed it. That's the time to remove a cyst, not when it's infected and inflamed. When it's infected and inflamed, you need to treat it with whatever it needs in order for the infection and the inflammation to subside. And then we will look at removing it once that inflammation has subsided. And I know it can be frustrating if people have had it for a long time, think, I see, I'm going to get it removed now because it's all gone bad. And we're like, oh, we're not going to remove it now. We've got to wait for it to settle down. So yeah, but that's the rationale behind it, because you will get an infected wound if you do it when it's inflamed. So that's me. Good interaction from the team. Okay. So I will be here next week if you're around. If you've got any questions, please do ask away, and I will do my level best to answer them. But in the meantime, have a lovely week, and I'll see you next week. End the stream.